purpose is to inform our audience that early detection is the key in the treatment of breast cancer, and that there are steps you can take to detect breast cancer early when it is most treatable. Did you know 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime? And more than 182,000 new cases will occur within 1 year.
Wow.
Breast cancer is the most common among women in the U.S. and it's the most common among African American women. Now, it is estimated that there were 39,840 women who died from breast cancer, and that there are 207,090 people, women, new cases that occurred in 2010.
30,000 died when?
39,840 women died from breast cancer in 2010.
In 1 year? Wow.
Yeah, and it was 207,000 new cases. Now, in 2011, it's estimated that 26,840 new cases of breast cancer and 6,040 deaths will occur this year from among African American women. Now, did you know early detection and effective treatment for breast cancer have been shown to improve the survival rate among women?
Yes.
No one knows the cause of breast cancer, but we do know the risk, which are being female and getting older. And although very rare, younger women under the age of 40 have been, new cases come up. 5% of the cases are women under 40 with breast cancer. The risk of getting breast cancer increases as you get older, as you age, and so it's very important that no matter your age, you should become familiar with your breasts and how they look and how they feel. This will allow you to notice these warning signs, which are a painless lump or knot, swelling, warmth, redness or darkening, changing the size and shape of your breast, dimpling, puckering of the skin, itching and scaly sore or rash on the nipples.
You know, they say that's an increase going on now. I guess we can say it in a video. Mm-hmm. There's an increase of people extreme because they don't have health insurance, because the economy's changed so much that they can't pay to get to their doctors, and so now you're seeing more of what you just described. Scary.
Correct. Now, they also suffer like nipple changes or discharge. It could be blood, pus, fluid, swelling in the armpit. You should and need to beware of these signs, because early detection of breast cancer, again, I cannot stress enough, is important regardless of the risk factors, because the earlier it's found, the better. Now, studies have clearly shown that the smaller the size of the cancer, when it's detected, the better the chance of the surgical cure and the long-term survival. Now, the American Cancer Society has recommended that breast self-exams on women should begin when you're in your early 20s. Now it should be even when you're younger, in your teens. Clinical exams should be in the women between 20s and 30s, when they're going for their health checkups at least every 3 years. Now, with the women age 40 and over.
When you say clinical exams, that's just a doctor doing a breast exam on you? Okay.
Yes, it's when you go to the doctor, you're getting your pap smear, and they do the breast exam also. And it should be at least 3 years.
Once every 3 years.
Yes. And when you're over 40 and over, you should continue to receive the clinical exams, do the self-breast exams, and also begin your mammograms, which should be annually, once a year.
Self-breast exam is only for 40 and over?
No.
Okay.
Self-breast exam should start at least when you're in your middle teens to 20s, so you can get to know the texture and how it feels, your breast feels, and the changes because of your hormones and everything, so you need to know. So when they say when you're over 40, you should still be doing your breast exams, going to the doctor, doing your pap smears, getting your breast exam also, and getting the mammograms with the machine. Now, the mammograms, again, should begin at 40, and it should be done annually, every year. And by using these methods, studies have shown a decrease now in breast cancer deaths which appears to be represents the progress due to their detection, improved treatment, and decreased incidence. Now, the 5-year survival rate for females with breast cancer has improved from 63% since 1960s to 90% today. So it's doing the breast cancer, the detection and prevention is the best thing. Now, until more is known about breast cancer and preventing the cancer, it's the silent killer, we call it, aka the silent killer, breast cancer among women. The best defense is early detection and effective treatment. Now, here's what you can do. Take action by getting regular mammograms, doing breast exams, the clinical exams, and making healthy choices within activity in your life and nutrition. Remember, the key to survival is early detection. Now, a recap in conclusion, the benefit of early detection of breast cancer: increased treatment options, long-term survival, and saves lives. I would like for you today to take an active role in your breast health by being aware of the risks, taking action, getting involved, and most importantly, informing your mothers, your sisters, your aunts, your nieces, your cousins, your friends, your co-workers, and even your neighbors, to let them know to be aware of the risks and the treatments of breast cancer so we can become the cure. Now, we are the cure, and again, the best protection is early detection of breast cancer. Now, here are some faces of survivors, family members of breast cancer, and who's doing the walk. Susan Coleman, Walk Against Breast Cancer. These people are trying to be part of the cure.
Oh, you tapped the symbol on the face.
And the treatments for breast cancer, you know, is the chemotherapy, radiation therapy, hormonal therapy. Chemo is IV, or it could be a pill. And then they also have the radio therapy. All depends on how far you progress. Then they also have the surgical, which is the mastectomy. Correct. And here's a picture of the surgical mastectomy when they remove one breast. But then sometimes they do breast implants to cover it, to make it so a woman can feel whole. Anything else? And that will conclude my speech.
Woo! Very nice.